could I get the Velasco's next?
For sure. Let's go, Nikki.
So, hi there. I'm Mr. Castalis. I'll be your nurse today. So, what exactly are your concerns here?
Well, this morning she started screaming and crying over her alarm clock.
Okay, it's interesting. Do you have any ideas why this would happen?
She was a veteran. She just came back from the army.
Okay, that's rather interesting. We're gonna have to run some tests on that. We'll take her upstairs. You guys okay with that?
Yeah.
Okay, well, let's go. Okay, so how old are you, Miss Velasco?
I'm 22.
Okay, so how exactly do you want me to help you here?
I just want to cope with this.
It's okay, calm down. It's okay. So, how do you learn the best?
Well, in the military we learn kinetic learning, if that helps.
Okay. As a young adult, one of the things someone of your age would be to do is create a SMART goal. And I think that would mean that the best way with this, as you're a kinetic learner, is through actions. So you're gonna make some goals on how you're gonna try and make something normal in your life, okay?
Okay.
Just try and follow these guidelines.
Okay.
Along with that in there is a few places I've listed that will help you with therapeutic help, and we'll meet back in a week or so to check on your progress.
Okay.
So, Mr. Velasco, it seems that from the test, your child is going through PTSD. This is pretty common with veterans.
I see. What's this mean?
Well, so PTSD is a sort of anxiety that comes from traumatic stress, and it's very common with soldiers as they go through a lot of stress within their lives. It's a little complicated to really understand, and let me just show you a video to help you further understand that.
Oh my god, my poor daughter. What can I do to make this go away?
Well, there are actually a lot of coping mechanisms that you and your family can do to help your daughter, and some of them include things like providing social support. So you're gonna want to spend a lot of time with them, and it's a really big part of the healing process. But don't pressure them about any of this PTSD things because it can actually make things even worse. Try and give them normal, so to speak, hobbies to do, and let them take the lead in it. Also, make sure that you manage your own stress because this is a rather stressful thing for you and your family to deal with, and that's why it's really important for you to deal with your own stress.
Thank you. Oh my god, everything will be okay.
Hey, Dad.
Okay, so if you remember earlier, I asked you what your learning style was, and you told me kinesthetic. Well, I just want you to keep in mind that there are several other types of learning, such as visual. So I just give you a pamphlet with pictures showing you how to help you cope. Although with something such as PTSD, it doesn't necessarily work, and it's more effective toward children unlike your age group. Another learning style to keep in mind would be auditory, in which I could tell you what to do, which is a little bit of what I'm doing right now, but it may not necessarily work for you. Um, hmm. Also, keep in mind that reading is another learning style that you could do. Although, reading sometimes the instructions can be unclear, especially with a scenario as complicated as this. So, I think kinesthetic really is the best choice for you, especially for your age group and your military background, as it allows you to just do what we're trying to tell you and give you first-hand experience with it.
Okay, so let's talk about basic client education principles. So there's five aspects to it. First is the ability to learn. Second is the learning environment. Third is the developmental stage. Fourth, the learning style. And fifth, the motivation to learn. So for the first aspect, the ability to learn, we need to assess the patient's capability to absorb information. So in this case, we have a person who has PTSD. So having PTSD, you may not be able to pay as much attention to whatever the nurse is saying. So that's another factor that we have to take into consideration when we make one of our interventions. So for the second aspect, we have learning environment. It's basically common sense. It's just like in a classroom, we need to make sure that the room is well ventilated. There's heating, and that you have to make sure that there will be confidentiality and privacy between you and the client, so it could make like a suitable environment for learning. So for the third aspect is the developmental stage. So based on the patient's age, you need to assess how they learn the best. So for example, toddlers, they learn by when they see pictures books, coloring books when you play with them. For adolescents, it's like a problem solving type of thing. For young adults, just like Nikki in the video, you have like a common goal setting, so it's easier for you to set goals for each other and for her to recover. So for the fourth aspect, the learning style. So there are four types of learners. First is a visual learner. Visual meaning I want to see. I learn by seeing. Second is auditory learners. Auditory meaning I learn by hearing. You tell me what to do. Third is reading. It's the ability to like comprehend what you read. And fourth is kinesthetic, and that's the one in the video since she is a war veteran. Okay, so now let's talk about the fifth aspect, the motivation to learn. So there's three types of motives. The first motive being social motive. It's demonstrated by people who want to fit in and want approval from society. The second motive is task mastery. It's the desire for achievement. You can see this in clients who say, "Oh, I want to win. I want to train as much as I can so I could be able to master whatever craft I'm into." And the final motive being physical motive. So you can usually see this in patients who want to recover from like a serious injury or some sort. You can see this when they say, "Oh, I want to get better. I need to go into therapy so I could walk again."